Hi, my name's Trish Rathie. I am a GP who works in Toowoomba. I have a fellowship from the Royal Australian College of General Practice. I also have a graduate diploma of rural general practice, a diploma of obstetrics, and a certificate of family planning, sexual and reproductive health, and I have an interest in medical education, and as well as a GP and mum and wife, etc. I am a medical educator for CSQDC based in Toowoomba. And I guess at the tender age of 8, I decided that I wanted to be a rural GP. Although over 30 years down the track, I'm not actually working in rural general practice. It's an enormous privilege to be involved in the education of doctors who are working in rural communities. I have never regretted my choice of both pursuing medicine and general practice as a career, and I think that it is an enormous privilege and responsibility to be involved in the lives of the patients and to be able to make a difference. I can remember a time when I had a woman come in asking for a termination of pregnancy, and I didn't say yes, I'll refer you on or anything else immediately. I just asked her why, and she went on to list the reasons why she wanted to terminate this pregnancy, and I didn't actually feel that any of those reasons would be solved with the termination of pregnancy. Because she was very, very early days, I actually asked her to see a psychologist and to come back and see me a fortnight later. 2 years down the track, when I was immunising her second child, as I held Molly in my arms, she thanked me for Molly. She chose not to end the pregnancy, and subsequently I looked after her during her confinement, immunised her, and at 2 years of age had this little Molly running around the rooms. I like to think I made a difference to that family. Other times in the rural community, I can remember a mum coming in, recently moved to Gundawindi where I worked for a year, and she obviously had postnatal depression, just with the move, her death of her mother, complications post-delivery, feeling very, very lonely. And it was one of the few times I actually got down on my hands and knees and begged somebody to take an antidepressant. 3 months later, she came into the surgery a completely different person and thanked me for saving her marriage, for enabling her to continue, that she never knew how bad she was until she started to get better. And so I think that by being a GP, I've been able to have a far greater influence on both the patient, but their family, and their life to come. And that's an enormous responsibility, but an enormous privilege as well.